Hello there, you're watching Debrief on CNN News 18. I'm Maha Siddiqui. It's taken cries of helplessness on social media, a flood of SOS messages filling up timelines and mayhem on the ground for the world to sit up and take notice of India's plight as it deals with a raging invisible enemy, the coronavirus. Efforts are now being stepped up globally to support India in this fight against COVID-19. India needs both help and hope as it goes through an unprecedented healthcare crisis that is leading to anxiety, uncertainty and despair. But the fight has to be fought, and there are those who are also inspiring us to carry on. But first, it's been almost a week, but shockingly, the oxygen crisis is yet to be resolved. The matter is in the Delhi court as several hospitals took the legal route to save lives. The courts have rapped the governments, first the centre for not ensuring smooth supplies, and now the Delhi state government. A quick status check on when patients can breathe easy.
India is in the ICU. Shortage of beds, ventilators, and something as basic as even oxygen. Some patients have been literally gasping for breath. The national capital being one of the worst hit, but promises of improvement are being made, even as it's a matter of life and death for some.
तो दिल्ली सरकार ने बैंकॉक से 18 टैंकर इंपोर्ट करने का निर्णय लिया है। ये टैंकर कल से आने चालू हो जाएंगे और केंद्र सरकार से हमने इसके लिए एयरफोर्स के प्लेन्स देने के लिए रिक्वेस्ट किया। फ्रांस से हम लोग 21 ऑक्सीजन के प्लांट इंपोर्ट कर रहे हैं।
This after the Delhi government raised a repeated SOS and several Delhi hospitals went to the courts. The Delhi High Court pulled up the centre, saying it was their responsibility to ensure smooth oxygen supply to the state. One of the main suppliers of oxygen to Delhi, Inox Group's director Siddharth Jain, told the court that the Delhi government wasn't getting its allocated 480 metric tons of oxygen, adding that the centre had reduced the allocation. Jain claimed that 4 of his tankers were taken over by the centre, starving Delhi hospitals of much-needed oxygen. Amidst all this, the centre's advice: use oxygen judiciously.
जिसको ऑक्सीजन सप्लाई की ज़रूरत हो उसको ऑक्सीजन दी जाए, जितनी क्वांटिटी में ऑक्सीजन सप्लाई की ज़रूरत हो उतनी ही ऑक्सीजन दी जाए। साथ ही जो इन्वेस्टिगेशनल थेरेपीज हैं उनको उनके नॉर्म्स के हिसाब से, क्लिनिकल प्रोटोकॉल के हिसाब से ही प्रेस्क्राइब किया जाए।
The centre has imported 20 cryogenic tankers and allocated them to the states. 551 oxygen generation plants will be set up in public health facilities across the country through PM Cares. The worsening crisis has spurred the centre and state governments into action. But it's coming at the 11th hour when thousands of lives have been lost. With Natasha Mendon, Anisya Kumar for CNN News 18.
From US to UK and EU to the Gulf countries, words of solidarity and movement of critical life-saving equipment now being dispatched in a hurry to India that is faced with an emergency. While the first batches of US and UK supplies of oxygen concentrators arrived in India, therapeutics like remdesivir and PPE kits are also being dispatched on priority. After months of preventing vaccine raw material supplies, the US says that it is diverting its own now to Serum Institute for Covishield production. Here's how the world is extending help to India. The world's richest country, one that has seen the full fury of the raging COVID-19 pandemic. America has finally stepped on the gas to help partner India as it battles an unprecedented crisis.
At India's request, we are exploring options to provide oxygen and related supplies. The Department of Defense and USAID are pursuing options to provide oxygen generation systems. We may be in a position to reroute shipments planned for other countries with lower immediate needs, but we've identified U.S. commercial suppliers of remdesivir that are immediately available to help relieve the suffering of COVID-19 patients in India. We've identified rapid diagnostic testing supplies, personal protective equipment, and additional ventilators.
The US also said that in some weeks from now, they'll be in a position to share 60 million surplus AstraZeneca vaccine doses. India has made no request for ready-to-use vaccines, though India has been asking US for over a month now to allow for the movement of vaccine raw materials needed by the Serum Institute of India.
The department is working closely with other US agencies to rapidly deploy oxygen-related equipment, rapid testing kits, personal protective equipment, and other essential materials to our Indian partners.
318 oxygen concentrators loaded at the JFK airport reached India yesterday, after which US President Joe Biden spoke to Prime Minister Modi. UK dispatched the first batch of life-saving equipment on Tuesday. Their overall supplies will include 495 concentrators, 120 non-invasive ventilators and 20 manual ventilators.
We need global supply chains to remain open at this very critical time. This is a time really for global solidarity, and it's very encouraging to see the number of countries who have stepped up to help India, in the hour of need, just as India helped other countries in their hour of need. And so on the vaccine front, I think we need to find this kind of a global solution.
India has imported 23 mobile oxygen generation plants from Germany. These will be airlifted for use at AFMS hospitals. Each plant can produce 40 litres of oxygen per minute. France and EU have also extended support to India in terms of critical supplies. France has promised 8 oxygen generators, 5 containers of liquid medical oxygen, 28 ventilators, 200 electric syringe pumps. Iran, Pakistan, Bhutan have expressed solidarity with India. There is increased realization that no one is safe till everyone is safe, as the virus will keep changing itself to attack humanity till it is completely defeated. In New Delhi, Maha Siddiqui for CNN News 18. Joining me now on the show, the German ambassador to India, Walter J. Lindner. Thank you very much, Ambassador, for speaking with CNN News 18. First of all, sir, since there is a critical need for generating and transporting oxygen to hospitals currently in India, what is the status of the help that Germany has extended to India in that direction?
Mahachi, good evening. It's good to be on the show again. And let me first start with the notation that you see the number of nations which are stepping in now shows how many friends India has around the globe. From everywhere, from each corner, they do help. So the fact that I'm sitting here, it's just by chance. There could be others also. It shows there's an international cooperation, and it shows also that it's a giving back, because India has done a lot in this COVID crisis, producing vaccines, producing medicine. So it's time for the friends also to step in and to do some back pay. Having said that, I see the international cooperation is pretty strong. Like you were mentioning the UK delivery today, it was brought in by a Lufthansa flight. So, and then EU help is coordinated by the civil protection mechanism in the European Union. So there is a global cooperation of friends of India who step in. When the government made a call to international call to provide some oxygen-related material, either oxygen or mask or other things. Many states around the globe have thought they should help. And as you mentioned, a few are already here. We are already also on our way. We intend to bring very soon a very big oxygen production plant, which is owned by our German military, and this needs some logistic preparation, because you need 2 A400 planes, flight planes, to bring it over, and then to people to handle it here. So we are, I guess, ready to go. We're just in the last details in Delhi to see what are these details, and then in a few days this could be sent away. This is a big plant which could provide a lot of oxygen. Apart from that, we have respirators on the way and ventilators, and of course the medicine remdesivir, which the government was asking for quite some huge quantities. So we are counting on the next few days whether this could arrive here in Delhi. Apart from that, we have oxygen plants which were bought by the Indian Army in a southern German company, and they, I think, are airlifted already by the Indian Army, brought over here. And then we're doing also something to provide logistics for the cooling chains. And we have a private cooperation between Tata and Lindner. Lindner is an oxygen producer, and they will acquire around the globe 24 oxygen tanks, or more than, I think 24 oxygen tanks, which provide a mean of transport between the hotspots and the producing plants. So these are a few things which Germany is doing. There are other European nations who do a lot, and you know, in cooperation, I think you will see quite a number of things arriving during the next days.
Ambassador, you know, Indian healthcare workers at the moment are stretched. They are tired because of the number of cases that are coming up. Is there any help that can be rendered on that front? Has Indian government requested for some helping hands as well, as far as healthcare workers are concerned?
I'm not aware of that, because, you know, around the globe, people are dealing with this epidemic and pandemic, and of course, India is very, very hard hit. But I think I haven't heard yet about that. But of course, I hear from everywhere, and I see the scenes on the television also, what is happening in front of the hospitals, within the hospitals, and these are the heroes. And of course, also heroes get infected. And what do we do when you have half of the hospital is infected? So I know that it's a very difficult thing. So if this arises further, then I think there will be another discussion. But I don't see so far which nation could send in people to help with the hospitals. I think India has a lot of people and a lot of well-trained people. So so far I haven't heard about this.
Okay. Ambassador, Germany has seen similar COVID waves, but it's been able to restrict the number of infections and, more importantly, the number of deaths. Is there any strategy that Germany used specifically that India can learn from right now?
You know what? It's very difficult for India to be compared to another country in this globe, because you have 1.3 billion people and you have a vast territorial country, and you have a lot of movement between countryside and big cities, and people live together very closely. So even the distance, social distancing, and the mask wearing is difficult to ask from let's say from a rickshaw puller. How can he keep distance? So I think the lockdown is a good way. We have lockdowns also in Germany, but you see even countries like European countries are fighting now with the third wave. So I think it's important to bring up the discipline and to see what kind of mutation of this virus you got here in this country. Is this especially aggressive, especially violent? And then see that we have no more gatherings of people, and discipline, staying at home, wearing masks. I try to also call on social media to everyone I know to maintain in the house and to maintain discipline. Whatever gatherings they will have planned, don't do it. So I think these are the measures we have globally around the globe. And India has a special challenge because it has so many people and the factors I mentioned. So that's why difficult to say from other countries how could India proceed here. I think India is doing pretty well, but it's just overwhelmed by the numbers.
It is indeed overwhelmed by the numbers. Ambassador, is there anything specific that you all are doing with the embassy staff as well to keep everybody safe?
Well, we have a total home office rule now. It's just me in the office and then the doctor and 2-3 other colleagues. We have quite a number of our colleagues, even the local staff and the German staff, positively tested. Some are in the hospitals, some have also seen those scenes you were describing. And of course, extended families, you know, so there are quite a number of cases. So we try to totally stay at home, to hunker down and, you know, not to have any contacts. And we do our crisis meeting, everything digital every day. So organizing this help, we do digitally, of course. But I think that's what most of the missions do here. And we ask people, those people who have some comorbidities and who are not vaccinated, to take an early leave. Maybe they can do that. And on the other hand, asking everyone, get vaccinated, get vaccinated, get vaccinated. That's the most important.
Absolutely. So this is a question now with regards to vaccines itself. At the World Trade Organization, India and South Africa are pushing for a waiver on intellectual property and patent of some of the vaccines, specifically the mRNA vaccines being produced in America, which are proving to be more effective against the mutated virus. Do you think it is time for countries to feel morally obliged and allow for a waiver as a one-time incidence right now, because we are in the midst of a raging pandemic?
You know, I don't want to go into these details of this discussion because it's a long discussion, a very complex discussion, because scientists and researchers, they also do the research because they are funded by the state and by the countries. So they would lose the interest in researching, I guess, if there wouldn't be any protection of the intellectual property. So it's a complex issue, but I do understand that there is a need for cheap or even without cost vaccinations around the world. That's why Bill Gates and many countries, including India, have set up the COVAX, which is an international organization or an international fund where richer people, richer countries and individuals pay money, and with this money you buy on the market. That's what is done at the moment. COVAX, they buy the vaccines, and these vaccines are cost-free, distributed around the globe, and some of them is produced in India, and India is shipping them. So this is the way, I guess, we want to achieve the goal that everyone on this globe can get a vaccination without have to spend too much money.
All right. Ambassador, many thanks for making time for us and speaking about this collaboration and coordination now that has been upped by the global community looking at the crisis situation in India. Many thanks, sir. We're taking a very quick break now. When we come back, we'll talk about the need for hope as well. Hope that all will be better soon, and there are some who are inspirational in that sense. More when we come back. And amidst all the gloom and doom, there's hope and kindness that is also peeking through. The ongoing Janata curfew in Maharashtra has helped bring the daily caseload down, but has affected the livelihoods of many. It is good Samaritans like Mumbai's Padma Kapoor who've taken it upon themselves to help the needy and the downtrodden with rations. Herman Gomes gets us this report.
With essential shops open for only a few hours every day in Mumbai, citizens are finding it tough to buy groceries. But a group of good Samaritans are going the extra mile to ensure supplies for the downtrodden. Padma Kapoor is one of them. She gives free groceries to those who need it the most.
As many as possible, frankly. And whatever my pocket can, I can manage, I'm ready to do it. At least if we can give them some nutritious food, you know, if we can provide food to the families whose people have gone into isolation, well, I think these two angles are really, really very important.
With restaurants open only for delivery, owners have to ensure that safety is paramount.
Deliveries, we've been, not now, in fact, it's been from last 1 year that we've been taking safety protocols like hand sanitization, temperature check, and the packaging, sanitizing the packaging, and checking about 6 feet distance between us and the delivery boys also. So it's been a 1 year total going on till now. It's not a break in between at all. With essential shops open for only a limited period of time, good Samaritans are coming forward to ensure that groceries are delivered to the downtrodden. And at the same time, with also a surge being seen in terms of deliveries, restaurants are going all out to ensure that maximum safety is guaranteed. Along with video journalist Rajesh Saple in Mumbai, this is Herman Gomes for CNN News 18.
And as India fights the second wave, here's a story of grit and determination from Mumbai's Ghatkopar. A 75-year-old Sarita Nakwe was given 24 hours to live after testing positive for COVID-19, but her resolve and willpower helped her defeat the virus, and she returned home in 13 days. Here's the story of this gritty woman.
It was a discharge to celebrate, a reason to smile and hope in these dark times. when 75-year-old Shailaja Nakwe was admitted to the Sonagra Surgical Center in Ghatkopar, Mumbai, doctors had given her 24 hours to live. Her CT score, iced here on the cake, was 25 by 25, the lowest, the most severe. COVID had gripped 75% of her lungs. Her saturation, that is her oxygen saturation, was 69%, and her diabetes wasn't helping either. And here she is, 13 days later, alive and smiling and counting her blessings.
Blank when doctors say you have hardly 24 hours in hand. But gradually, mom started responding very positively to the line of treatment. Friends, family members from all walks of life, they started praying and prayers answered. After a few days, mom was actually on a 15 liters oxygen supply. Started gradually reducing to 3 liters, 2 liters.
If somebody goes and talk to the patient that you are good, nothing is going to go wrong with you, in that case patient recovers fast. They need a morale, high morale. If their morale is high, they come out.
Shailaja Nakwe will take 6 months to completely recover. At home with her family, she needs regular oxygen support, something the family has managed so far. Shailaja is not the only one who has punched out the virus out of her system. This shy 62-year-old housewife from Ujjain in Madhya Pradesh had 95% lung damage. For 40 days, Usha Nigam was on ICU battling the coronavirus. Every day defeating a new complication it threw up. 2 positive reports, plasma therapy, and a 2-month stint in hospital later, she's back at home and a star survivor.
उठ नहीं पाती थी, बैठ नहीं पाती थी, कुछ भी बहुत कमजोरी आ गई थी, खाना नहीं खा पाती थी, तो चम्मच से मुझे खाना भी खिलाया छोटी वाली ने, बड़ी वाली ने, दोनों ने। अभी कैसे हैं? अभी ठीक है? अभी बहुत बढ़िया हूँ, पूजा पाठ से सब पूरा काम कर लेती हूँ घर का।
The Chief Minister of Madhya Pradesh has tweeted out her story in the hope that it encourages others. With Bureau Inputs, I'm Shreya Dhondiyal.
And there are those who are going beyond the call of duty in these tough times. In Uttarakhand's Almora, one COVID warrior is working day and night to ensure that people are tested and treated at the earliest.
लेकिन उनसे कह दो पीपी किट पहने। 33-year-old Jitendra Devrari, a microbiologist by profession, is heading the only state-run testing centre at the Almora Medical College since December last year. Devrari and 3 of his colleagues process every RT-PCR sample that comes to the lab. Sometimes that works out to 1,000 samples a day.
मैं और मेरी टीम हम लोग यहाँ पर इसमें नर्सिंग स्टाफ, टेक्निकल स्टाफ सब लोग का श्रेय जाता है। हम लोग रेगुलर यहाँ पे लगभग 900 से 1000 सैंपल्स प्रतिदिन कोरोना की जांच RT-PCR टेस्ट के माध्यम से करते हैं।
Devrari has been working without a day off for nearly 6 months now. The team is testing samples day and night and trying their best to give reports within 24 hours of collecting them.
यहाँ पे बड़ी अच्छी तरीके से जांच का कार्य चल रहा है और RT-PCR रिपोर्ट यहाँ पे फटाफट 24 घंटे के अंदर रिपोर्टिंग भी हो जा रही है यहाँ पे और काफ़ी सुविधाजनक माहौल करा हुआ है यहाँ पे और जितने भी पेशेंट आ रहे हैं यहाँ पे सब खुश होकर के जाना है कि जल्दी से रिपोर्टिंग हो जा रही है और जगह पे तो रिपोर्ट मिलने में टाइम भी लग रहा है, यहाँ पे बहुत जल्दी रिपोर्टिंग हो रही है।
To ensure that no time is wasted in travelling, Jitendra Devrari and his team live near the lab. They say they are just a phone call away and always ready when duty calls. With Kishan Joshi in Almora, Anasya Kumar for CNN News 18.
Well, that's it then for the moment. See you again tomorrow. Bye-bye.